Hey guys, welcome back. This time around we want to take a look at the interactions between the autonomic nervous system divisions. Now, as we mentioned previously, the autonomic nervous system is a dual innervation system. And this means that most of the organs and glands are going to be innervated by both the parasympathetic and the sympathetic branches of the autonomic nervous system. Now, if you recall, the parasympathetic and the sympathetic nervous systems are going to be antagonists, which means that what one stimulates, the other will inhibit. However, typically one of the branches will dominate the effects that we are realizing at rest. And this branch we typically say sets the tone. And the tone means the normal control of a given function. If it's a sympathetic tone, the sympathetic division controls things such as blood pressure and keeps the blood vessels in a continual state of partial constriction. It will be the responsibility of the sympathetic nervous system and it alone to regulate things such as the blood pressure by regulating the diameter of the blood vessels. This sympathetic tone we call a vasomotor tone. Now, vasomotor tone specifically says that the sympathetic will determine the constriction of blood vessels at any given time, and it causes the blood pressure to rise when those blood vessels are stimulated to constrict. And it will also, when axons stimulate the muscles to dilate, that will result in decreasing blood pressure. Typically, our alpha blockers are going to be drugs that interfere with the vasomotor tone and are used frequently for things such as hypertension. Sympathetic tone is also responsible for things such as shunting off the blood to the visceral organs during periods of exertion. Let's think about that. We only have a limited amount of blood. When we are exerting, our skeletal muscles are contracting at a very vigorous rate, and they're going to need a lot of ATP for these activities to occur. And that ATP appropriately should be created by aerobic cellular respiration where possible. And so we need to redirect the blood we have to the skeletal muscles and the surface of the skin. We also need to redirect that blood to the central nervous system so we can ensure that we have the proper levels of blood and blood pressure during this period of exertion. The result is, though, we shunt the blood, which means we reduce the flow of blood to things such as our digestive tract, urinary tracts, and reproductive tracts. So we cut down on our digestive capabilities, our ability to form urine, and our ability to form reproductive organs when we are exerting, when we are in emergency mode. On the flip side, the parasympathetic tone. In the parasympathetic tone, we'll see that it opposes what happens in the sympathetic tone. So the parasympathetic tone at rest is going to determine our heart rate. It's going to partially inhibit actually the efficiency of the heart. The heart can beat at a much quicker clip, about 100 times per minute. But at rest, we usually set that rate at about 70-75 beats per minute, and that's set by the parasympathetic. The parasympathetic tone also will dictate the level of activity for the digestive and urinary systems and most of our glands, except those of the sweat and adrenal glands, because adrenal glands are going to be the ones that produce the hormones that manage our body during stress. Drugs that block parasympathetic responses increase things such as heart rate and block fecal and urinary actions. Best example of a cooperative efforts would be if we take a look at the external genitalia. The parasympathetic nervous system is going to stimulate the vasodilation of blood vessels and result in the erection that occurs either in the penis or in the clitoris. The sympathetic nervous system, on the other hand, is responsible for the ejaculation, and it's also responsible for the reflex contractions of the female's vaginal smooth muscles. Other examples of the dual innervation effects can be seen here in the diagrams. Now, what I would want you to see from these tables is that when the parasympathetic is responsible for stimulating an event, the sympathetic would be responsible for inhibiting that event. So anytime we're in a stress situation, the sympathetic will override the parasympathetic. And first and foremost, inhibiting those things that the parasympathetic can stimulate. And then secondly, to initiate the things that the sympathetic can drive. In many instances, you'll see that the parasympathetic has very little effect on things such as blood vascularization and blood coagulation and cellular metabolism and adipose tissue, whereas the sympathetic will have the sole response to that. In that case, we're looking at things that are going to be controlled by the sympathetic tone. The control centers of the autonomic nervous system are going to be found in the central nervous system. While the central nervous system controls the autonomic via the spinal cord, brainstem, and cerebral cortex, It will be the hypothalamus that is considered to be the master integration center. Typically, the anterior hypothalamic regions are going to direct the parasympathetic functions, whereas the posterior hypothalamic regions typically direct the sympathetic functions. The hypothalamus does not do it alone, though. Instead, it integrates with things such as the brainstem, particularly the reticular formation, the medulla, and the pons. And collectively, this cluster will regulate things such as heart rate, blood pressure, body temperature, water balance, endocrine functions, emotional states such as rage and pleasure, and biological drives such as thirst, hunger, and sex drives. These centers can be trained, and when they're trained, then that means what is happening there is the involuntary nervous system, the autonomic, is actually being taken over or slightly manipulated by our voluntary. A training effect is always a voluntary nervous system response. The voluntary, the control, can occur through the cerebral cortex, and it would be a biofeedback techniques that would slow the heart rate, slow the breathing rate, and regulate muscle tone, especially skeletal muscle tone. The best known natural technique to control involuntary functions using thought processes is going to be yoga. While frustrating and time consuming, if acquired, biofeedback mechanisms are going to be a very valuable attribute and typically extend the life expectancy of the human. The last thing that I'd want you to take into consideration would be developmental aspects. Now, if we're looking at developmental aspects associated with a youth, we would see that typically the autonomic nervous system impairments will occur due to injuries. Now, if we're looking at old age, though, we'd find that the autonomic nervous system efficiency decreases as we age. It can result in things such as constipation, dry eyes, and something known as orthostatic hypotension. Hypotension means a lower than normal blood pressure. Orthostatic hypotension is a form of low blood pressure that occurs when the sympathetic vasoconstriction centers respond slowly or more slowly to changes in position, particularly that oppose gravity. Say we're laying down and we want to stand up. If we stand up suddenly, what we might feel is a faintness as we age. Now that's associated with the fact that the sympathetic is one, and it has a very slow conduction rate, if you recall, because of the lack of myelination. And secondly, the stimulation, the atrophy of the nerves as we age. But collectively what we would see is that we might feel faint-headed because it might take a moment, a split moment, for us to constrict that blood vessel. And when that happens, that constriction, it would increase the blood pressure to the blood flow into the head. So between that period of faintness to the moment which it clears up is going to be the time it takes for that constriction to occur. You guys have a great day. Hope you enjoyed the autonomic nervous system.